Hello, everybody. We're just gonna wait for Dr. Polack to join so we can start our part 2 to the Get to Know Us with Dr. Polack. All right, let's request moderator. I added her too. Oh, there we go. Perfect. Hello, Dr. Polack.
Hello, everybody. Let me raise my camera a bit. There we go. Hello, everybody. Thank you.
We're here with Dr. Polack, and this is our part 2 to our Get to Know Us series with Dr. Polack. We're happy you're here. And if you are looking for a new pediatrician or a new long-term medical home, this is your place. So, Dr. Polack, how are we today?
Hi, Ashley. Hi, everybody. I'm Dr. Noha Polack. I'm a pediatrician at Progressive Pediatrics. So thank you for joining me for our second session. Last week, I told you a little bit about our practice, but today I want to go a little bit deeper. I want you to understand what sets us apart in Hudson County as a pediatric practice. What sets us apart is actually that we really focus on continuity of care. We love to take care of children throughout their whole childhood from birth to the age of 21. We want to be your trusted partners, and we only have pediatricians at the practice. We only see kids, no adults. So we want to be your child's long-term medical home, right throughout, from birth all the way through college. So what does continuity mean? You get to see the same providers every time you come to the office. We do our best to stick to 1 or 2 providers, but sometimes that's not possible. Our group of providers will see your child and take care of them well. Why does it matter? Because when there's continuity, your child is safer. When your child is known by a practice or a provider, it's just a safer community altogether in terms of medications, what your child likes and dislikes, all that stuff. We also guarantee same-day sick care. So if you call us that same day that your child is sick, as long as it's within office hours that you call, we will see them that very same day. Because when your child is sick, you don't want to wait and be worried. We also have 24/7 and a 24/7 answering service. So if it's something that's upsetting you in the middle of the night, you can call no matter what time it is. You'll get expert care from really great nurses who can call us at home if they need to for more information. We also have something called photo triage. So if you're worried about anything, let's say there's a little rash, a red eye, a little bump or a swelling, and if you're worried about it, send us a photo in the patient portal. We're going to take a look at that photo. We'll send you a message right back with a recommendation. We're going to say something like, oh, we need to see this child right away, bring them in, or this is normal. Or we could also say, let's do a televisit, but we will take care of your concern that very same day. We have fast portal support. So if you send us a message on the portal with or without a photo, we're going to respond to you that same day as long as you send it within office hours. You don't have to wait days for a response. However, the patient portal is excellent for everything except for urgent matters. If you think your child has an urgent issue, please use the phone and call us because that's the fastest way to get a hold of us. We have pediatric expertise. Everyone in our practice only sees children. So it is really important for us all to realize that expert eyes are very important when your child is sick, not just someone who's used to taking care of much older people as well as children. It's really a different way of caring for children than from adults. So we want to be here for every stage of your child's life, from the time they're breastfeeding or bottle feeding all the way through college, where we can hold their hands and talk to them about other safety things. We love talking about things like growth. We like talking about vaccines a lot. We talk about development, behavior, and we answer all your questions. So thank you for listening again and watching this. I'm here to answer questions. If you have any, please let me know. And I just want to say one more time that our mission at this practice is to be your child's long-term medical home and to provide them with continuity, expertise, and safety.
That is very well said. Now, I do have some questions that maybe we can help future patients or anyone just looking around for a new pediatrician a little bit more info. So, for example, do you have experience with bilingual or multicultural families?
We do. Many of our families come from different countries. All the staff speak Spanish. Many of the providers also speak Spanish. There is Arabic in the practice also spoken. I think those are all the languages right now.
Okay, sounds good. And then, what should families expect during well visits?
So during well visits, depending on the age group, for infants, we really do a lot of measuring. We look at growth charts. We talk a lot about development. So development is usually the longest conversation, as well as nutrition, growth. And then we do some anticipatory guidance, just telling parents what's going to happen next. During the preschool and school age years, we do a hearing and vision check. We check blood pressures, and we do all the same stuff again. We discuss the measurements. We discuss nutrition, safety, screen time, sports participation, all those good things. So it's usually a pretty involved discussion, to take care of the whole child.
Okay, great. And what's your policy on scheduling appointments for routine checkups and urgent visits? Is there any wait times?
So usually we give the routine visit appointments within 1 to 2 weeks maximum. And most of our patients will make the next appointment at the last appointment. So when they come in for one well visit, they'll make the next one at that time, especially for infants.
Okay. And how do you handle sick visits versus well child visits to minimize exposure to illness?
Right. So we do our best not to use our waiting room at all, just so that you know. We want every patient to come in as scheduled, right? They're going to go right into a very clean, sanitized exam rooms. We also have different exam rooms that we use only for well children that never house sick children, and vice versa, ones that are only for sick children. So we don't use our waiting room. We have specialized rooms. We certainly sanitize the room in between patients, as well as we have HEPA filters and all kinds of complicated things in the HVAC system.
Oh, right. Interesting. And what is your approach to continuing education and staying current on medical advances?
Oh my goodness, do we do that a lot? So there's always so much to learn in medicine. We go to grand rounds at hospitals, right? There's a lot of virtual grand rounds that keep us up to date. We're also board certified, and we have to keep updated with certain number of CME credits, which is continuing medical education.
All right. And how do you typically communicate with parents, especially when there's a medical concern or emergency?
So if a parent calls after hours, the nurse will answer that phone call. The nurses have so many triage protocols and answers that we don't usually get called by the nurses unless there is something that is concerning. Either a patient requests to speak to a physician, or sometimes there's something that if the nurse is concerned and wants to send the patient to urgent care or to a hospital, they will call us and we will talk to the parent as well.
I see. So we also have a parent here on the chat who wrote, Progressive Pediatrics has been an incredible choice for our family. Every provider we've met has been patient, knowledgeable, and genuinely attentive to our questions. For any first-time parents looking for a caring, reliable practice, Progressive has been everything we've hoped for.
Oh, that is so kind. Thank you for saying that. I really appreciate the shout out. We sure do try really hard.
We sure do. Well, with that, I think we have all our questions for today. We always are available to answer any questions over the phone. If you need to speak to a provider, we can schedule a new patient tour so you can get to see the office, meet a provider, and any insurance questions that you may have. But for that, that's all.
So Ashley, I want to say a couple more things. I want to tell parents that absolutely, whether you're coming in for a prenatal visit or if you want to come in just to kind of establish care. So to establish care, you just need to come in, and you can come in and talk to a provider just in general about things, but we cannot answer any questions about your specific child unless we see your specific child. We'd be happy to do that. So if you want to give us a call, let us know. We also have online scheduling through the patient portal. So once you're our patient, you can also schedule appointments online.
Correct, yes. Well, that was very good. I think it's very informative. And like you said, if anything, just give us a call and we'll answer anything we can.
Thank you for watching, everybody. Have a great day.
Thank you. Bye-bye.